You hear the words crowns for teeth, and suddenly your mind jumps to drills, pain, and a huge question mark. But what if I told you most people misunderstand crowns completely? Dr. Esma, today we are opening a door dentists rarely walk you through. The good, the bad, and the parts nobody explains until it is too late.
Exactly, Rasim. Crowns can save a tooth or quietly cause problems if the wrong choice is made. Most patients never hear about materials, long-term risks, or why two crowns can feel completely different.
So if you have a crown, need one, or were told you might someday, stay with us. By the end of this video, you will know the questions that change everything. We all know someone who says, I got a crown, and something never felt right. Maybe chewing feels off, maybe there is pressure, or maybe years later, another treatment suddenly becomes necessary. Dr. Esma, this is where people stop blaming themselves, right?
Yes, Razim, and that is the problem. Patients think discomfort is normal or temporary. But sometimes it is a sign of a crown that does not match the bite, the tooth, or even the patient's lifestyle.
And nobody warns you that a crown is not just a cap. It changes how you chew, how your jaw works, even how neighboring teeth behave.
Exactly. The real issue is not the crown itself, but the missing conversation before it is placed.
So this really matters, because one small decision today can echo for years. Dr. Esma, give us a real-life picture. What actually happens when a crown is chosen without thinking long-term?
Rasim, I see it every week. A patient comes in with jaw tension, headaches, or a cracked neighboring tooth. The crown looks fine, but it was too hard, too high, or wrong for their bite. Over time, the mouth adapts in unhealthy ways.
That is scary, because people think a crown is the end of the story.
Exactly. When done right, a crown protects. When rushed, it quietly creates new problems.
Let's zoom out for a second, Dr. Esma. Crowns have been around forever, yet confusion is still everywhere. People assume newer always means better, or that every mouth reacts the same.
That assumption causes trouble, Rasim. A simple example. Studies and daily practice show a large portion of crown replacements happen not because the crown broke, but because the surrounding tooth or bite failed first.
So the crown survives, but everything around it pays the price.
Exactly. One patient needed a replacement after only a few years, simply because no one adjusted how their teeth met when chewing.
Alright, Dr. Esma, let's put on the science glasses for a moment. From an expert point of view, what is really happening inside the mouth when a crown is placed?
Great question, Razim. Scientifically, a crown redistributes chewing forces. If the material is too rigid or the fit is slightly off, those forces travel to the root, jaw joint, or nearby teeth instead of dispersing naturally.
So it is physics, not luck.
Exactly. When dentists respect biology and biomechanics, crowns feel invisible. When they ignore them, the mouth starts fighting back quietly.
Alright, Dr. Esma, people are listening closely now. Walk us through this the right way, step by step, so nothing gets missed.
First, Razim, we slow down. We examine the tooth, the gums, and how the jaw moves. Second, we choose the crown material based on bite strength, habits, and long-term goals, not just appearance. Third, precision matters. Digital scans and careful fitting prevent hidden stress.
And the final step most people never hear about.
Follow-up. We check the bite again, listen to feedback, and fine-tune. That is how a crown disappears into daily life.
Before we wrap this up, Dr. Esma, let's protect people from common mistakes. What are the biggest do and do not moments with crowns?
First, Razim, do not rush. If a crown feels wrong, speak up immediately. Do ask what material is being used and why. Do not assume discomfort is normal. Pain is information.
That already sounds like advice most people never hear.
And finally, do not skip follow-ups. A crown is not a one-day event. It is a long-term partnership between your mouth and your dentist.